This episode was brought to you collectively by our Beauty Brunch event partners, Manse Clinic, Biodroga, Synergy Skincare, Dermatonics, and Vitasol. Hello and welcome to the Beauty Industry Podcast, your online support community for the professional beauty industry. I am your host, founding director of Beauty Industry, Tamara Shaw. Here we are closing the competitive gap and speaking your language. This is a platform created and dedicated to the professional beauty industry, valuing community over competition. We serve to help connect you with inspiration from industry experts, expand your knowledge through educational pieces, and bring you the latest in product and technology innovation. This is Beauty Industry. Our guest today is someone I am sure you follow on Instagram, but not because she's an Instagram influencer posing on beaches in bikinis, but rather due to her before and after photos, her injectable videos, and those memes. Our guest today is the most followed Instagram account in the cosmetic medical industry in Australia, with over 210,000 followers, which puts her in the top internationally. Dr. Naomi McCullum is the founder of the Manse Clinic and a pioneer in the field of non-surgical cosmetic medicine. In 1999, she became one of the early members of the newly founded Cosmetic Physicians Society of Australasia, and when the CPSA became a college in 2015, Dr. Naomi was admitted as a fellow. The Manse Clinic is situated in the idyllic suburb of Paddington, New South Wales, featuring 5 cosmetic doctors, and its mission is to fight every flaw that is necessary to create a high-end, beautiful look that takes their patients to the life of their dreams, which they often do by creating their signature doll look, which you'll hear more about today. Dr. Naomi now focuses on her role in management, social media, and creating online cosmetic information for the Manse, which she shares more about in today's episode. From the Manse Clinic, today we welcome Dr. Naomi McCullum.
Thanks for having me.
Our absolute pleasure. I'm sure we've taken some time away from your very busy schedules, so I really appreciate you coming on board and having a chat today, because you have been a heavily requested guest on the podcast from our beauty industry community.
Oh, that's lovely.
So, Dr. Naomi, we start the podcast in the same way every single episode by asking our guests to take us back to the beginning of their career and kind of describe how you entered into the cosmetic and beauty industry, if you can do that for us.
Okay. Wow, it's a long time ago. So I studied medicine, started when I was 18, and then I graduated, did my internship and residency. And then I wasn't happy. There wasn't really anything that I wanted to do. And then, am I allowed to say on your podcast?
I don't think so. We'll say anti-wrinkle and injectables.
Okay. So I went and had anti-wrinkle injections, and I just thought, this is the career. I want to be a non-surgical cosmetic doctor. So, I just got right into it as quickly as I could. It was quite difficult at the time because it was such a tiny industry, no patients, no one doing it. But I found out about a doctor who I could ask, a doctor in Perth, and she said to me, you've got to come along to this conference. This is in 99. So I went to my first cosmetic conference and just fell in love.
Fantastic. I think, it's so hard when school tells us at 18 that you've got to choose a career for the rest of your life, and you're kind of thinking, oh my goodness, I'm not an adult yet. I don't know who I am. How am I supposed to find that? But I love that you had the treatment yourself and then wanted to kind of dive down further into that industry.
Yeah, thank goodness.
I think it's also important that you have had the treatment. Sometimes I speak to beauty therapists, for example, who want to, or even nurses who want to go down the cosmetic pathway. And I say to them, have you had any treatments yourself? Have you experienced that side of being a patient? And they haven't. And I find that so polarizing, because how can you perform the treatment if you don't know what your patient's experience, what, perhaps the side effects are, or the healing process of that treatment? Do you agree?
I think it's really funny if you'd be doing a procedure all the time that's bringing so much joy and happiness to people that you wouldn't want to do it to yourself. That's what I find. I just want everything because I see what happens when people have it.
Yeah, absolutely. And so the landscape of the industry has changed since 1999 when you first joined. What did it look like back then?
Oh, so the first conference was tiny. There was hardly anybody there, a tiny group of doctors, hardly any trade. The trade show was tiny. Yeah, it was very different.
And not so many clients and patients wanting the treatment now, I can imagine.
No, there were very few patients out there.
Was it always in your foresight to open your own clinic then once you got into the industry?
Oh, I think I always went in wanting to have my own clinic. Yeah, day one.
Yeah. Why was that?
I suppose because I loved where I worked. I worked at the best places in Sydney, and my mentors were amazing, the people that I worked for, but they just didn't do it in the way that I wanted to do it.
Yeah, it's definitely a difficult one. What was your first treatment that you performed cosmetic wise?
Oh, wow. My first job, actually, this is unbelievable. My first job was when microdermabrasion was had a Medicare rebate to it.
Oh, wow.
Yes. Not many people will remember that, but then it was taken off the Medicare rebate list. So, yeah, that was my first treatment.
And what was your first cosmetic treatment performing?
Um, Probably anti-wrinkle injections.
Mm.
Oh, actually, I worked for, no, it would have been a lot more laser first because I worked at a dermatology clinic that had 15 lasers. So I did a lot of laser back then.
Fantastic. Can
But
you
at
remember?
that job, I did a lot of injectables as well. But first of all, anti wrinkles, but filler pretty much at the same time.
Can you remember that first time that you've got the needle to the client's face? What was running through your mind? What were your thoughts in that situation?
Oh, I was so young. I was having a ball. I wasn't nervous or, yeah, it
Loving
was
it from the
different back
beginning.
then.
And so you've got your own clinic now, which you worked in for a little, but you've decided now to kind of step away from injecting and work on the management side of the business. What was the strategy behind doing so and not just continuing to inject?
Well, I'd really burnt out with the injecting. I'd seen too many patients. I was just, I'm an introvert by nature, and being in a with somebody every 15 minutes, 28 times a day, every day is very, very hard. And I did it for years.
Yeah, absolutely. So wanted to kind of step on the other side. Are you a real leader by nature? I know you said you're an introvert, but do you love leading teams and kind of creating something special for people to work in?
So I am not a natural leader at all. I think I'm really hopeless, or I used to be hopeless, but I've had a lot of years to improve and I've read a lot about it. I have a mentor to help me. Um, but I think that's just something you've got to work on like everything else.
Yeah, absolutely. And what is it about the Manse Clinic? You said when you were working at other clinics and injectable service places that something just wasn't quite right for you and you knew that you could do it perhaps a little bit differently. So, how do you do that at the Manse?
I suppose I really wanted something uh, more luxurious, yeah, than what was available. Really high end, super service oriented.
Mm. And I think we can see that now. I mean, injectables are so saturated in the market, and some businesses have gone for, that really quick experience in which you can just walk in and have anti wrinkle or filler, in the next half hour. But I think the consumer is now coming back to being a little bit more heavily weighted on the actual experience. So the sensory aspect and taking time and having that true walk through the clinic and understanding the entire procedure, not just wanting a quick fix. So you've almost come full circle in being a little bit ahead of the trend in giving that experience and that high end luxe kind of setting to your client before clients or even after it. So congratulations, pretty impressive.
Thank you. Thank you. There's always been people who want quality though. So thank goodness.
Yeah, absolutely. So now you're working more on the management side. You're obviously running the social medias and bits and pieces like that. What does a normal day in your life look like?
Okay. So, a lot of it is spent on my social. So I'll wake up, I'll make a post, I'll make a couple of posts actually. Um, and then I'll go have a coffee, get some energy, and then I'll often have meetings throughout the day with different people. Um, I'll try and go in and video a procedure or two, talk to my team, and then the rest is really just being online, working on everything.
Amazing. And speaking of procedures, the man's lips are a signature treatment, and a lot of people see that on your social media. And I saw actually a video the other day of the non surgical rhinoplasty, which I said to my husband, I need that treatment. Do you have to
Ah,
be careful about trending treatments and treatments going out of fashion?
there's always fashion in cosmetic medicine, um, but beauty is still pretty standard in a way. So I'm not too worried about that. But there's more fads for what people want to have done. So, this jawline's really big, or when fat dissolving the submental area came out, that was big. Um, I feel like non-surgical rhinoplasty is quite an old fashion. So it's interesting that you think that that is a newer fashion.
Perhaps maybe we're just seeing it more on social media, so it feels like a trend.
Yes, probably.
And talk to me about the Manse doll. What is that? And for those who don't know, how was it created and what does that typical aesthetic look like?
So I guess they're just the absolute beauty achieving type person. So they want every little detail. So every detail of their face, every detail of their hair, their lashes, their clothes, they're just perfect.
Incredible. And so, how do you look at a face and decide what's perfect as an injector? Or is it the patient comes in and they've got their idea of what's perfect?
So face design is the most important skill in this industry, and it is one of the least common skills in this industry. So, um, to answer your question, though, the you'll really assess a patient on how they present. So at the Manse, what we do is a patient will come in and then we'll get their presenting complaint, so what they would like to improve, but then we'll do basically a full facial assessment, which will include the bone, muscle, fat, skin, symmetry, profile, basically everything. And we'll just detail everything in an objective way and then have a discussion and see how they want to proceed. So we just give them our skill. So we show them how they can get to the best possible version, but then it's really up to them what they want to do.
Yeah, I like how you're leaving it in the patient's hands. At the end of the day, you can definitely show them what is achievable, but not almost forcing it on them and really leaving that indecision with them, which is very important. We will be back with more of the Beauty Industry podcast after this short message from our sponsors. Sydney Siders, we are bringing you a morning of coffee, connection, and conversation in our 3-hour breakfast networking event held on Sunday, the 26th of May. Hear from nutritional medicine practitioner Fiona Tuck, business owners of Labella Medi Spa, Rebecca Miller, Skin to Fix, Robin McAlpine, and Elevate Hub, Bernie Rees. Tickets are just $49 and include gifts from our event partners, Spa & Clinic, Biodroga, Synergy Skincare, Dermatonics, and Vitasol. Head to the website www.beautyindustry.com/events for more information. We cannot wait to see you there.
Oh, definitely. They're the one who's got to go home alone and look in a mirror. So you really want to work with them and make them happy.
Yeah, absolutely. And you're talking about face design there. I'm sure on Instagram now, the kind of aesthetic of what the average woman looks like, and I say women because I'm assuming that women are the most injected out of the two. But how of Instagram and the online presence influenced the cosmetic world, do you think?
I think the use of, the beauty apps, the filters, that's really, really affected our industry because what we're seeing is just not real. No celebrity is how they look online. No Instagram model is how they look online. And so the bar is super high for what people want these days because of that. But you've got to bring reality to it. So that's part of the consultation as well, setting expectations and just letting people know what's actually possible, and so that they can know what can be achieved, not something unachievable.
Well, that was going to be my next question, that maybe clients have unrealistic expectations, and it is because of the filters, and you've got all those face tuning apps that you can make eyes look bigger and make waist cinch in and look smaller and things like that. But I love how you've said there, it is up to the injector to have that realistic expectation and then have the client actually see that. It's like coming in with a full face of acne and expecting to click your fingers and to be cured tomorrow, essentially. It's having that realistic expectation. Well, here is what we can do. Will there be residual scarring afterwards? Probably. But actually working with the design of the face to say, well, here is the bone, here is the fat. There's only so much we can do, but this is what we can achieve.
Yes, it's really important. It's a bad idea to get started with a patient who can't understand reality.
Yes. Yeah,
Yeah.
absolutely. And so, speaking of Instagram, you're now the number one followed Instagram account in the cosmetic medical arena for Australasia, which is absolutely amazing. And I read that this all stemmed from your blog. When did you realize that social media was the place to be and the influence almost that it could have on your business?
So when I started my blog, I wasn't really doing it for marketing. I was doing it because there was no information out there at the time. So I just wanted to share as much information as I could to help people set their expectations and know more about the industry, just increase the transparency. Um, Probably because when I was younger, I had a rhinoplasty. Well, I had two that were really botched, and I felt like I just wanted to get the truth out there so people thinking about procedures would know the truth rather than this overly positive marketing that was out there. So that's why I started. And then I loved making content, and so it sort of flowed that I started to want that to be my career, to be a content creator. And say when I went to blogging conferences, social media was discussed a lot there, and it just went to social naturally for me.
Yeah, that's incredible. I love that it has had such a big impact on your business when I watch your videos and you see people, in the comments saying, I need this treatment, I'm going to fly to Sydney, or can you open a Manse in this location? It's a clear drive for your business, which is fantastic. And your honesty on Instagram, because that's a platform you're most active on, is very refreshing, which I think people really appreciate. I've recently been following along with your conversation with what is believed to be the scammer called the General.
You're
um,
following the general love story.
I'm
Thank you.
following. And so, for those who don't know, essentially, as we would all know, there are people out there who are trying to, take people for, a run and trying to get money out of them and things like that. But you have responded, in the most hilarious way, which I think, is a real clear nod to how you take the online world. Talk to me about the meme culture and specifically the fakery that you point out on the before and after photos that we all see on Instagram.
It's so revolting. It's so horrible. Everywhere on all of these cosmetic accounts, the fakery is just horrible. From starting from people who steal others before and afters, which has happened to me hundreds of times, and other clinics claiming them as their own, to the lighting difference, to the angle difference, to the, all of the dodgy things that people do. I'd love sharing information about that so that patients can't get fooled by it. But I still see that patients are very fooled by it.
Yeah, well, when you don't know better, you look at an image and you just think, fantastic. I can achieve that. And even myself, at the moment, I'm having some ultrasonic treatments for a little bit of tightening and fat cavitation. And my first appointment, I wore the most daggy underwear possible. And I said to the therapist, oh, next time I'll wear some better underwear for you. But then on my second treatment, I thought, actually, no, I need to wear the same underwear so that the body doesn't look different, and that's just one aspect of taking a before and after photo. But then, for example, as you said, you've got the lighting, and I know that some people are now even face tuning, for example, pigmentation removal and little bits and pieces like that, which is just crazy cakes in my eyes.
Yeah, it's really sad. Unethical people in all industries. Yeah, it's a shame.
Yeah, absolutely. But I love how you call them out and you're like, no, this is not correct. Look at the different lighting. Look at the angle she's at the moment. I think that's probably where your popularity comes from, because everyone appreciates someone who's a little bit more genuine and calling it as it is, and they're not trying to cover anything up, being very transparent. And that, from a consumer point of view, that is probably why you are most followed and people want to come and see you, because they know that they're going to get what they see, which is fantastic.
Yeah, so I've been that way since the start. If I used to blog about our cosmetic complications, and people thought I was absolutely crazy, but consumers love seeing when you share the problems that happen, and also the discussion what to do when the problems happen. It's so helpful to them, because then it's known. If I was a consumer, I'd love that too.
Yeah, absolutely. And so,
well, actually, I am a consumer, aren't
you
I?
are a consumer, yes. Exactly right. We see you all the time having procedures, and I love it. And, watching the other day, even you were on the operating table and still taking selfies. It's just hilarious. But there are whispers of a second Manse Clinic to open this year. Can you give us any cheeky insights on more about these plans?
Oh, yeah. It's opening in the CBD. We're in Castlereagh Street. It's just we're having trouble with council, strata, just getting the plans through. But we'll satisfy everybody and get it done. It just takes time.
Fantastic. How exciting. Congratulations.
Thank you.
And so, lots of things happening. You're currently working on an e-commerce store. Why online shopping, and what can we expect to see on there?
So I want to do the same that I've done for injectables, but for skincare. So I just want to share a lot of information about all the brands, all the different products, so that people can know the truth and make some decisions. And if they want to buy it, they can buy.
Is there specific ingredients or perhaps formulas that work better with cosmetic surgery and injectables and all of the like?
Oh, definitely. So certain lasers, you'll want to have certain products after them. So yeah. So a lot of my content that I will write will be sharing that type of information.
Fantastic. So watch this space. Amazing. And I'm sure our audience follows you already, but if they're not, can you just share for us your social media platforms and point them in the right direction?
So most followed is my Dr. Naomi 1 on Instagram, and the Manse Clinic on Instagram.
Fantastic.
But you can follow me on Facebook, or you can follow my website as well. My web gets so for people who are into that type of content, go to the website but for some education, come to my Instagram.
Incredible. And what's next for yourself and for the Manse Clinic? Obviously, you're opening up the second store. You've got the e-commerce store. I'm assuming that you're a lady who just grabs life and runs with it. Is there anything else that we can expect from yourself, or new treatments perhaps?
Well, I just got the okay to say this, but we're making a pilot.
A show?
Reality show.
Oh my goodness. Fantastic.
Yeah.
Is that going to be free to air, can I ask?
So we don't know the platform yet. That hasn't been confirmed. So we'll see. Keep watching my social and you'll find out.
Yes, absolutely. And I'll definitely share with our audience in the show notes, and also across all of our social platforms when that goes live, because I'm sure everyone's definitely going to want to follow along and watch you. You've had a few TV appearances lately, so we definitely want to see your face more on our TV screens.
Oh, scary.
Hence why you got the new lip lift.
The third one.
The third one. That's exactly right. Well, thank you so much for featuring on the podcast today. I truly appreciate all of your time and your insight. I think, we have interviewed some injectors on the podcast before, and it's just so nice to hear that you're all trying to change the industry for the better and make things more transparent and really help your clients and the consumer understand the way forward for the treatments, and just outlining all of those expectations. So I truly appreciate that.
Thank you. Thanks for.
My pleasure. Thank you. That was Dr. Naomi from the Manse Clinic. As you know, anyone who is trying to challenge the industry and create a space for transparency and questions from consumers is the greatest asset to the industry in my eyes, and Dr. Naomi is certainly that person for the injectable world. If you haven't already, you must tune into their next live treatment video across social media, and if you wish to dive further, take a read through their online blog. As mentioned, watch this space for her new clinic, the online product store, and the pilot of her new TV show, which was so special that you got to hear it here first. If you know of someone who may enjoy today's episode, please take a screenshot and share it across your social media channels so that we reach more ears and keep the industry in conversation. Until next time, stay connected.